To health options. Tuberculosis, TB, is one of the 10 top causes of death worldwide. In 2016, 10.4 million people fell ill with TB and 1.7 million died from the disease. It is a leading killer of persons living with HIV. In 2016, 40% of HIV deaths were due to TB. Multi-drug resistant TB remains a public health crisis and a health security threat. 95% of TB deaths occur in low and middle income countries, which Nigeria belongs. On this edition of Health Options, we take a look at TB burden in Nigeria and control efforts. Don't miss out on medicinal plants available for the management of arthritis on our Nature Scanner, as we also bring you health tips on arthritis. Get inspired to restore hope to someone in need as you meet our Health Champion of the Week. It's nice to have you join us on the program. I am Rabi, Abdallah. This is Health Options on the Nigerian Television Authority, the NTA. It is our discussion segment, and our focus is on the burden of TB in Nigeria and control efforts. First, this background report by Aisha Uba Ali.
Tuberculosis, TB, is a disease said to be the 9th leading cause of death globally. Among factors that aid vulnerability to TB and access to care are malnutrition, poor housing and sanitation, compounded by other risk factors such as tobacco and alcohol use and diabetes. The Tuberculosis Global Report of 2017 indicates that TB is responsible for the death of nearly 1.7 million people each year and confirms that Nigeria is the 7th among the 30 high TB burden countries in the world and 2nd in Africa. More disturbing is the fact that while other countries are gradually winning the war against TB, the case is that Nigeria is yet to attain the desired results. Unlike in the past, government programs towards ending TB has been initiated. These include providing universal access to quality care, efficient surveillance and tracking of patients, among others. Despite significant progress over the last decades, TB continues to be the top infectious killer worldwide, claiming over 4,500 lives a day. The emergence of multi-drug-resistant TB poses a major health security threat and could risk gains made in the fight against TB. March 24th every year is also a day set aside to observe the World Tuberculosis Day, with the intent on intensifying awareness, strengthening collaboration of development partners, and increased fund towards reducing its mortality rate. According to the National TB and Leprosy Control Program, there are thousands of new cases every year in Nigeria. To compound the challenge, substantial numbers of the people infected in the country are unreported or undiagnosed, most of them women and children in neighborhoods where poor ventilation abates the spread of the disease.
Thank you, Aisha. Joining me in the studio to discuss the topic is Dr. Abdallah Lawansin. She is the National Coordinator, TB and Leprosy Control Program, Federal Ministry of Health. Welcome to Health Options, Doctor.
Thank you very much, and good evening.
Okay, we're looking at tuberculosis. and we know that the burden is really high. Let us into the Nigerian situation, even though the statistics have been reeled out in that background report.
Actually, in Nigeria, TB burden is very huge. Annually, according to the WHO Global TB report, we reported 410,000 cases, that is patients, of having TB in Nigeria. And out of this, there were 154,000 deaths. Of the 410,000 cases where we were expected as Nigerians to actually detect, that is TB cases to be detected, we were only able to detect 300,000 cases.
Why is that so?
Why? Because we believe that the low TB case finding is because a lot of Nigerians are not well informed about the disease. And many of our people who have the disease do not go to the right places to seek help, where they can be investigated, tested, screened, and if they are found to be TB, they link to treatment. Many of them go to patent medicine store, they go buy drugs, cough mixture over and over again, and they are missed out in proper treatment. And that is why also we are having increase in the multi-drug resistant TB, because many people are not going to the right places, they're not getting the right treatment, and then a lot of the microbacterium is developing resistance to the regular simple antibiotics that actually treat the disease and cure disease in 6 months.
Okay, TB is associated with coughing and all of that.
Yes.
How does one know he has TB?
Yes, primarily because TB affects the lung primarily, and we call that pulmonary TB. It will also affect other organs in the body, such as the bones, the kidney, even the meninges, that is the covering of the brain. And with that, it presents in ways that actually depicts that it's affecting those other organs. But primarily, because it affects the lungs, what we call pulmonary tuberculosis, people who have such disease will present with cough, majorly cough of 2 weeks or more. They also have night sweats. They will be sweating when the environment does not warrant it. They also lose weight, and I also get tired very easily. Those are the symptoms and signs of the disease. So when people see that they've been having cough and they've been going to using medication and it's not going for 2 weeks or more, then they should suspect that it could be TB and they need to go and seek help.
So how accessible is treatment? I know of the DOT strategy, that's the direct observation treatment strategy.
Yeah.
How have we fared with our DOT strategy?
Drugs, like in Nigeria, we have 7,000 DOT centers.
Okay.
We have 2,615 microscopy centers. That is, those are the microscopy where you can use to investigate TB. But then there is a modern way of testing this disease, which is faster. Not only that it's faster, it's also helped to pick the resistant strain. That we call the gene expert test. The gene expert test site in Nigeria is 390. Even though the government, when the policy came out in 2016 March, the government had wanted that we have these centers in every local government in Nigeria. That is to say, 774 sites in Nigeria. But unfortunately, we are just about maybe 40% of that, thereabout now.
Which means we still have a long way to go.
We still have, and that is why the government now is looking at universal healthcare coverage. No, the government is talking about universal healthcare coverage, in which TB is part. So the government, what government is doing, and with the support of partners, is to scale up these gene expert sites. Not only scaling it, but to optimize the use of those sites. Because right now, even though those sites are there, people are not accessing the services. And there are some other confounding factors that are not helping us to optimize. And that's the effort that the present government is looking at critically, to say that we want people who are sick of this disease, they should access these services. Why? Because this service is even free.
Okay.
It's free. You go there, you get in there, you don't pay a dime. the TB affects not just the adults, but also the children. And then the children, because, and one thing, because we're not even finding the adults, we're not also finding the children. Like in 2017, we're only able to find 7% of what we are supposed to, what the WHO depicted that we should find. And the reason is that investigating and TB in children is difficult because many of them cannot produce sputum. But one thing that the government is also doing now is to scale up the chest x-ray, support the chest x-ray of children. We have our partners providing resources for us to support. What I mean by supporting is that when these children go to the chest x-ray site, they pay nothing. Their parents pay nothing. And all this just to help to uptake the services, to let the parents to be, to encourage them to take their children, the children that are not thriving. You see a child who's supposed to by now be walking, supposed to have gained weight, the child is not gaining weight, then it could be TB. Then they go to see the health worker who will now direct them to do the chest if that child cannot produce sputum. But if the child can produce sputum, then the sputum will be used to, the chest gene expert test will be used to diagnose the TB.
So we can do that now.
We can do that. Okay. And one good thing now is that before now, the treatment, the drugs for the children is bitter, is not child friendly. Sure. So I know a lot of children, they wouldn't want to take. And that also is affecting the treatment outcome. So, because when the children are not taking the drug, when they have the disease, of course they won't get better. And then there is a risk of having a resistant strain. But now what the minister launched on the 23rd of this month, at the commemoration of this year World TB Day, is the new fixed dose pediatric formulation, which is sweetened and also flavored to make it attractive for the child. And it's also dispersible. Just put it in the water, in a little quantity of water, it disperses and the child takes it. So it is child friendly, it is mother friendly. You don't need to struggle with the child for the child to take it. And with that, it makes treatment outcome. We believe it makes treatment outcome better because the children will take it.
We know TB is a disease that is associated with poverty. What are some of those other predisposing factors for people to avoid?
Overcrowding. Okay. We know people living in overcrowding environment, not well ventilated environment, and then in dirty environment. Those are things that people should. But more importantly, we also want to emphasize that people who have HIV, if they cough of one day, I said TB is cough of 2 weeks or more. For an HIV patient, even cough of one day, they should come so that they can be investigated, to make sure that we investigate them to see they don't have TB. But for HIV patients who do not have TB, we also place them on what we call isoniazid preventing therapy to make sure that they don't come down with TB. Okay.
Thank you so much, Dr. Lawanson, for coming on Health Options.
Okay, thank you very much.
I have been speaking with Dr. Abdallah Lawanson, the National Coordinator, TB and Leprosy Control Program, Federal Ministry of Health. Moving on now, arthritis is a joint disorder featuring inflammation, causing pain and stiffness that can worsen with age. Let's go over now to our nature scanner for a peep on medicinal plants available for the management of arthritis.
Arthritis is a very common condition in our environment and has been misunderstood by a lot of people, such that some people, when they have slight symptoms or pains, that they should actually see their doctor. They begin to say, I have arthritis, and then a lot of people also think that once you are old, any pain that you have is an arthritic pain. That's not really what it is. Commonly, arthritis is joint pains. That is the common way to say it. There are several types of arthritis. There are about 100 types of arthritis. There's arthritis that has to do with joints. There's arthritis there's even what infectious arthritis that is as a result of infection. It might not really be at the the point of bones joining together, but that there is an infection that results in inflammation. We have worked on so many plants, because the truth is, when you look at our environment, and I mean our environment here, you see a lot of plants at our backyards that have what we call secondary constituents or phytoconstituents, okay, biological constituents, biomolecules that have the ability to take care of arthritis. What I'm holding, for example, is aloe vera, and everybody knows aloe vera, and it's a very good plant for arthritis. I am not saying that you should go and drink aloe vera if you have arthritis, but what I'm saying is that this plant, you can grow it anywhere in our environment. So our job in this era of modern science and technology, is to get minimal resources to convert this to the form that it can now be that people can access, so that people don't need to go to bush and cut the plant. All they need is the aloe vera tablet, aloe vera capsule, aloe vera syrup for them to use in taking care of their arthritis. I'll show you another one, which is very popular. Ginger. Everybody knows ginger. People drink ginger, and that is why we promote nature's approach to use of medicines. So any medicine that I'm telling you here, that we are presenting to you, that we are discussing here, are natural. In fact, they are like your food. We now take this to the lab. We do our studies using animals. Then we come up with the dose that is now useful to man. It is in that, when you now see our capsule or tablet or syrup or powder in that natural form, it is now it now has specific dose that study has been done on. That's the point I made. So it's the same with ginger. We have red ginger, white ginger, and it's the same with turmeric. There was a time on this program we talked some time ago about turmeric and ginger, and we said how turmeric, for example, has been used for years, and in its natural form, very potent against cancer. In the same way, it has our studies in the lab on animals and human primates. We have proven that it has a lot of anti-inflammatory properties. It is that anti-inflammatory property that is useful in the management or treatment of arthritis. I specifically had to bring this one out today for you to see what we can do from the back of our house. See, no matter the type of pains that you have, all you need to do is to rub gently, mildly on that area. You will have serious relief, or have these things available in our own communities that we can use. So this is nature's own way of ensuring that arthritis is properly taken care of. We have dwelt seriously on the drug treatment or management of arthritis. It's also important to say here and to advise us that it is good to also prevent these things, because there is this saying that prevention is better than cure. Prevention is not only better than cure. The truth is that ultimately prevention is cheaper than cure. So some of the factors that are responsible for people developing arthritis, as much as possible, if you know such things, you reduce your activity or you prevent them. For example, your lifestyle. It is proven that there's a certain lifestyle that favors development of arthritis. Smoking has been proven to be a factor in development of arthritis. So people who genetically are predisposed to having arthritis, and you are a smoker again, then you are liable to arthritis. Now, sedentary lifestyle, because being overweight is implicated in arthritis. Therefore, you need to ensure that you don't get obese, you don't get overweight, because your weight on your joints, will help in the development of arthritis. So then there are certain, food that we should, as much as possible, especially once your doctor has diagnosed you of arthritis, there are food that are rich in uric acid. Purine is a product of cell metabolism and, eventual conversion to uric acid. Uric acid, yes, is useful in the body, but excess of uric acid, which is not being removed from the body, could lead to accumulation, and then it will result to arthritis, inflammation of the joints, swelling, and what we call gout, will develop. So it's important, therefore, that people ensure that they are not sedentary in lifestyle. You undertake regular exercise. You avoid overweight or weight gain, and then you eat good food, balanced diet of rich in vegetables and fruits all of the time, and then drink a lot of water. There won't be a side effect as a result of drinking of water.
Now, being humanitarian means to have values and an understanding of human situations, regardless of race, ethnicity, religion, and social status. Meet our health champion.
Manage this, in a few days, let's pray for God to give us what we're expecting.
Turning ideas into tangible change daily may not be an easy task, but for Uju Kennedy, sponsor of Kenuj Shower of Love, a charity initiative, genuine commitment, sacrifice, the ability to give and show love to the less privileged is what she craves and finds fulfillment in. A habit she has nurtured from childhood.
Even as a child, if I go to church with my mom and I'm giving money for offering, I give it out to beggars before I enter the church. I've always believed in that because I feel the church gets enough, while those out there, they need help. I believe in helping. So many people are suffering. And now you ask yourself, how does God answer those prayers? Is he going to come down from heaven to answer the prayers? No. God must use somebody to answer the prayers. So I volunteered myself to God, and I said,
with challenges in the Nigerian healthcare system and many lacking access due to financial and economic constraint, Mrs. Kennedy has interest in offsetting hospital bills for needy patients, building and equipping healthcare facilities for deserving communities, and all this in a bid to help indigent persons.
I've given out dialysis machines to Annunciation Hospital. Is a Catholic hospital in Enugu, and then at the health center. But the important thing is that I carry out research to know those villages that really need these things and that will benefit from it. So the joy in this whole thing is those things getting to the right places at the right time, and for people that really will benefit from it.
No doubt an angel to those who have benefited from her compassion, she says she wants to reach out more. But how far does she intend to project this passion?
Kenuj is somebody known to the hospital, a very great philanthropist. She comes to National Hospital from time to time to assist the patients. She puts her money in our account to help patients. She actually be bringing a lot of patients to the hospital too. Very serious cases, that needs a lot of intervention, and she pays for them.
Thank you, Ma. And may the Almighty God continue to make you to be more than this.
Thank you very much.
With calls for support and partnership for the good of society, Uju Kennedy has words for those who can help.
What do you need in life? How much food do you eat? Even your children, what is it they need that you're packing all that and depriving the less privileged? When you ask yourself some certain questions, you will know it's out of love from God that you are, whoever you are. Then the little you can do for God is to go back there and allow him to use you to answer prayers. You start touching lives.
Hope you have been inspired. This is the size of our package for this week. You can go to our YouTube channel to watch the upload of these and other episodes, and email us for your comments and contributions at healthoptions@nta.gov.ng. Thank you for investing your time with us. My name is Rabi Abdallah. See you again.